that he will also deliver the great talk.
The times factor.
Can I get my slide? Hi, thank you for this opportunity. I'm Dr. Aditya Sethi from Gurgaon and Delhi. I'm going to talk about something very exciting, artificial intelligence ophthalmology, which I feel is a bridge between the last two talks. It fits right beautifully in between telemedicine and sustainable operations in the future. So artificial intelligence has already been effective in a lot of ways in our healthcare already. So drug discovery is one of them. We know latest medications, vaccines, drugs which have used AI as a generative tool to find out the right ingredients. It also has worked in the underserved population, improving speed and accuracy of diagnosis. It has taken data from a lot of EHRs or EMRs and actually found out the more perceptible population and given us more strategic target sites for our activities. Just 2 days back, there was an article in the Ophthalmology Times which spoke about the first robotic retinal surgery which is done. It's done in Belgium, and it was just successful 2 days back. So it's ever changing. Every moment there's something new happening in artificial intelligence. And of course, research and clinical trials is one of the best possible places where AI has been used. So basically, AI is not new. In 1950, Alan Turing spoke about in his article, Can Machines Actually Think? And this is evolved to the Turing's test, which is basically evaluation of machines' behavior to exhibit whether it can think like a human brain. And this laid the foundation of AI. But the AI timeline is very vast. It's as vast as 1950 going on to today. And that little spot you see in between, that's the AI winter. AI winter was a blog where there was complete blockage of AI activities, which were absolutely unsuccessful, and they call it the winter. So thereafter, AI in healthcare has been something that has been ever evolving, and today we have reached a stage where we have AI on our phones, AI on our glasses, AI on our wrist, so everywhere. And last 2 decades, there's a lot of transformation in healthcare. There's data from the watches you wear, there's data from your phones in your pocket, there's data when you sleep and you put your phone next to your bedside, there's data all around you. And this data is now being summarized by AI and by various companies, and that's used to get proper diagnostic, personalized medicine, and patient care management. So all those apps that help you sleep well, all those watches which monitor your heart rate, is actually collecting data which can be used in a proper way and get the right person at the right place in a personalized fashion. So ophthalmology is basically the best place for AI, because everything we do, from a spectacle number till getting a photo till getting an OCT, is rich with data, and that data is utilized in the right way is what we're here to talk about. So significance in ophthalmology, the first study which was actually done with AI goes back to 1970. This is the CASNET study, which was done in the US and was talking about glaucoma considerations and consultation programs in 1970 to deliver personalized approaches with AI. And the most successful one we all very aware of is the mycin one, which was basically to find out the exact antibiotic and create better antibiotic which is available today. So again, there are a lot of milestones. One of the largest or the best milestone for AI is the FDA approval of the IDX-DR platform, which is now allowed to independently diagnose diabetic retinopathy in the US and various other places. Got an FDA approval to do so. And that has made the telemedicine very popular with this particular product, and more and more diabetic retinopathy patients have been able to be screened who don't have the access to ophthalmologist or a specialized ophthalmologist. And the spectrum continues. Now, basic 3 types of AI which are there are artificial narrow intelligence, which is basically designed for specific tasks. We have artificial general intelligence, which is supposed to match the human brain, and artificial super intelligence, which is supposed to super exceed the ones we see in Netflix movies and we are pretty scared of. So currently, luckily, most of it is for particular tasks or ANI, and that's what we are focusing on. We're not focusing on something which matches the human, and it's not here to replace any of us or our brains. It's here to just augment us, and that's where AI has a role. We have deep learning and CNNs in ophthalmology, which pick up on images, how it feels and how the diagnosis will be made, and various milestones. It's also been used in glaucoma now highly successfully. Look at the sensitivity and specificity rates. It's as touching 90% in both of them. Real world impact, we had the Watson from IBM, which has spoken about the Google AI, which we're very well aware of, where they've taken a fundus photo from the camera of the phone, and the clinical outcomes are just mind-blowing. Diabetic retinopathy studies, the DR is the most popular one, and we have the IART study. Both of them are very good. I'm going to talk about some challenges of AI. Now, basic challenge of AI is the data quality. So the image that we provide to the AI has to be of a certain quality, otherwise we misdiagnose. A lot of us say we use AI, but it doesn't give the right value. And the basic problem is that the specificity or the image quality varies, and that's what causes the problems. Second is getting it integrated on your already existing EMRs and EHRs. So none of us are willing to part with what we already have. So it's very important for these AIs to come as an add-on rather than a replacement. Ethical and legal consideration, I think we are well versed with this. A lot of questions have been raised about ethicity, the data leak, whether this data is secure or not, or will this AI start talking on its own. These are all considerations, bylaws that we have to make today so that tomorrow we don't have a problem. And a lot of committees have been formed legally and politically all over the world. Next step is basically getting the doctors and the patients to trust this AI. So the only way towards that is making a very transparent AI, something that shows what exactly this AI is doing rather than saying, oh, it's a secret, just punch in, let's see what happens. Because transparency leads to trust, as simple as that. And ethical framework, we have to protect human autonomy. So basically what we want is the autonomy should be with the doctor, should be with the patient, not with the AI. And basically the black box, which we keep talking about, which talks about transparency. And that should be it. The synergy between AI and ophthalmologists is very, very important. And getting that into the right place will actually make this a very viable tool. And I think in the next couple of years, I won't even say 5-10 years, this is going to be a very important part of our practice management and our community management. And I think that is where AI is right now there. And it can completely evolve on its own as well. It really depends on the data we as ophthalmologists feed into it and how it will be tomorrow. So it gives a very personalized approach. AI is still a baby, even though it's born in 1950. It's really started growing up now. So it's very important to not match it to the diabetic specialists or the glaucoma specialists we have here, but give it the aid so that it can actually get the proper education and become something better tomorrow. Thank you so much for your time, and I hope I was able to shed some light on AI today.
Any comments?
Thank you, Aditya, for an excellent insight into artificial intelligence. And I think as we get as it is more standardized and we get the ethical approvals, I think we can use it very strongly in our remote screenings, and where you don't even need teleophthalmology. So now we have quite a few